Thank you very much. My name is Felister Mwangangi, and I work for Phillips Pharmaceuticals. Today we are calling ourselves Phillips Therapeutics. My apologies. We just changed the name, and we are still in the process of trying to align ourselves with the new change. So I'm the country manager for the line Menarini International, and we have this fantastic product. Okay, I was hoping I would be able to share my screen, but it is well. It's not able to share. So basically, we have a product for premature ejaculation. Premature ejaculation is a very common problem it's one of the commonest problem men experience from the age of 18 to 64 years. I've been facilitated to share my screen.
Yes.
Thank you. So we have this product called Privilegy, and Privilegy is indicated for premature ejaculation. It is the first and only on-demand oral drug approved for PE, premature ejaculation treatment. I want to begin by a few, 2 or 3 captions from some of the experts. Like, for example, in Kenya, we have a sexologist called Professor Joachim Osur. And Osur oftenly contributes to Saturday newspaper, Nation newspaper. Every Saturday usually has a caption to discuss sexual related challenges in marriage and also for partners. And he says that premature ejaculation is common. The man emits ejaculation too fast, leaving the lady hanging. Unfortunately, not many men know that they can be able to get help. This is a caption he had done just the other day. And another sex expert called Vanessa Marin, I just picked 2 of the experts, in April 2019 said that premature ejaculation is one of the most frustrating sexual challenges. I believe we've been discussing part of, from the discussion as I was following, it is aligned to sexuality and some of the challenges our young people or even couples face. What are we saying? Premature ejaculation can feel awful and awkward for both parties, and it can be really hard to talk about, especially in the beginning of the relationship, when people are trying to get to know each other and they are afraid of their vulnerability. So many couples suffer in silence. The American Urologist Association says that PE, or premature ejaculation, is the most common sexual dysfunction in men. And they state that 1 in every 5 men aged between 18 and 59 years old have premature ejaculation problem, either once or a certain time in their life. Premature ejaculation, what is it in essence? Premature ejaculation is when one starts and ends without him or his partner getting satisfied. So we call it the problem of coming too quickly. The bigger problem is that those who are suffering from it just suffer in silence. In fact, Professor Osul always insists, do not suffer in silence. Don't bear the shame. There is help, you can be assisted. Now, so what is it? What is this premature ejaculation? The International Society for Sex Management defines premature ejaculation as ejaculation which always or nearly always occurs prior to or within about a minute of vaginal penetration from the very first sexual experience. And this, they call it lifelong premature ejaculation. We also have secondary premature ejaculation, or what we call acquired premature ejaculation, which is a clinical significance reduction in latency time. of about 3 minutes or less from the moment of penetration, intravaginal penetration. Ordinarily, we say that it's the inability to delay ejaculation on or nearly all vaginal penetration on the part of the man. And it comes with negative consequences such as distress, frustration, bothersome, and many men, because of such kind of frustration and the inability and the frustration, they tend to avoid sexual intimacy. Where do they go? Many a times they go into alcohol, or they get stress. They go into depression. We should not allow our people to go through this, because men don't talk about their problems. Unfortunately, many of them will suffer in silence. It's not like women who will complain and say that I am not being satisfied. And you can imagine when a man is being told by the lady, we will not tell them nicely. We will complain, we will whine, we will frustrate, because we are also frustrated. You are busy climbing the hill together and all of a sudden you're left alone. So this is very frustrating. So the man tends to avoid the intimacy, or even tries to go out there to check whether the problem is regular, or either his wife or his regular partner, or it's something, or it is inborn, a problem that he has to deal with. So I have this demonstration of how a normal sexual response looks like as compared to a premature one. After sexual stimulation, as you can be able to see here, we get the penile tumescence. The man is excited, there is erection, and then that period of erection takes longer. There is what we call a plateau, which allows the man and the lady now after penetration, after intravaginal penetration, to be able to enjoy together the experience, the sexual experience. And then in the process of the enjoyment, when they are able to come through together to experience orgasm together, and then there is the resolution. So there's a moment like 2-3 minutes, 4 minutes of that plateau. On the other hand, in the premature ejaculation situation, there's a very short plateau after excitement. The man, immediately after stimulation, it tends to come within 1 minute or 2. In fact, some will experience ejaculation even before they have intravaginal penetration. And others will experience it immediately after intravaginal penetration, and they have no control over it. This is what we are saying leaves them frustrated. So the plateau period is extremely very short. What are some of the current treatment options that many have been adopting or being recommended to use? Is usually the psychological or the behavioral strategies, whereby one is told either to pull out or to count backwards, something. There's also topical anesthetic agents like lidocaine, some creams that are available in the pharmacies. There's also the use of chronic antidepressants, the SSRIs, off-label, and this the patient is required to use every single day of his life. For them to start experiencing any benefit, it has to go like for more than 2 weeks. We have PDE5 inhibitors, there's tramadol, there's also anesthetic condoms, and all these are off-label treatment regimes. Then we have Dapoxetin, which has been purely developed for the treatment of premature ejaculation. It's also a short-acting SSRI, which is specific for this kind of condition. And as I mentioned, here is a comparative trial whereby all these particular products, the SSRIs, the Dapoxetin itself, the antidepressants, have been studied on 5,000 patients who were experiencing such kind of a situation of premature ejaculation. And it was discovered that Dapoxetin, or Privilegy, because Privilegy is the innovator brand, was quickly and rapidly absorbed. Within the first 1 to 3 hours, there were reasonable concentrations of serotonin in the synaptic cleft. And the presence of the high levels of serotonin were able to delay the ejaculation. And the beauty about Dapoxetin or Privilegy is the fact that it does not accumulate into the system. It actually gets excreted from the metabolized and excreted from the body system within 24 hours. So there is no accumulation, there is no dependency with this product as compared to other chronic antidepressants that have been used for the same indication and taken every single day, which accumulate in the system. And the moment the patient is withdrawing or discontinuing the treatment, they tend to have withdrawal challenges. Now, as I've mentioned, why treat PE with a short-acting SSRI? Serotonin is considered as the key neurotransmitter involved in controlling ejaculation process. Now, there are multiple serotonin receptors in the brain and the spinal cord. The moment the serotonin is rapidly reabsorbed through these receptors, then the problem occurs, the problem of premature ejaculation occurs. But when Dapoxetin or Privilegy, the patient takes Privilegy or a short-acting SSRI, these receptors bind, the drug binds to the receptors, and the reuptake of the serotonin does not happen, increasing the volume or the level of serotonin available in this synaptic cleft, and this leads to delay in premature, or rather delay in the ejaculation process. So the man now is able to have better control of his ejaculation. This enables the man to be a man, to have his confidence back. Now, as I've mentioned, Privilegy gets rapidly absorbed. Unlike other antidepressant SSRIs, which one requires to take every day.
Yes, Felister, please finalize. We are actually behind schedule.
I am almost doing that, actually. I want to mention that we also have the problem of ED and PE. ED is when one is not able to sustain ejaculation in the process of sexual intercourse. However, PE is when they come quickly. The two sometimes happen together. Our patient can be having the same problem together. And the two can actually be treated, both with atadalafil.
Hello, Felister.
Yes, I'm actually summing up. So Privilegy is taken 1 to 3 hours prior to planned sexual activity, and the tablet should be taken with at least a full glass of water to ensure that the patient is well hydrated for the process. They should only take 1 tablet 24 hours, and it's not a daily dose, it's just on demand. This enables the patient to have better control of his ejaculation, increased ejaculation in the vaginal latency time, and also takes care of the frustration, the bothersome, and the avoidancy, and ensures that the two couples last long together. So in essence, treating premature ejaculation ensures the partners last long together. And Privilegy will confirm this from the use of the very first tablet. And this is my last slide. Hello, Davis.
Hello, thank you. Thank you so much. It was really informative. I'm sure anyone who will be interested, please kindly reach out to us through the Ryculture email.
Thank you so much.
Thank you so much. I also appreciate for the opportunity. And later on, I'll be able to share my number just in case anybody within this group or will have any questions. I would be very happy to be able to discuss.
And the most important thing is to acknowledge that there is.
Thank you.
That was a very good presentation. Can you share it on emails?
Oh yes, I can. It's with Davis, but if you share.
So this is one thing. The reason as to why we gave them a chance is because you look at these issues of sexuality, most people don't want to talk about them.
Yes. I need to share my telephone number.
Yes. So you'll all have access to the presentations. I'll share them with everyone after the sessions are over. But what I needed to acknowledge is the fact that people don't talk about issues on sexuality, but at the same time, these are the very issues that are affecting us. I heard from a discussion with a group of friends that most kind of relationships end because of sexual dissatisfaction. So, well, those are issues that we have and we need to look into them. The only thing that I would recommend from my perspective as a pharmacist, don't prescribe these products for yourself. Don't use them because you feel you need to use them. Reach out to a qualified healthcare practitioner who will give you guidance, assess your situation, and consider the product to give. You can't give them a recommendation that you heard about this product, yes, but don't make the final decision by yourself. It's not recommended medically. So thank you so much, Felister, for the wonderful presentation. Thank you so much, Phillips team, for the good work that you guys are doing to address some of these concerns that we have. And I'll hand back over to you, Michelle, to continue the session on the next bit. Thank you.
Okay, thank you.